Ministry of Health. If you have been directly exposed to the new coronavirus or have a history of travel in infected populated areas, it is recommended that you self-quarantine. Identify a room to be used to self-quarantine and limit contact with healthy persons. Keep away from older persons and persons who have medical conditions that affects their immune system. Monitor for any cold or flu-like symptom for up to 21 days and wash hands frequently with soap and water. If you become seriously ill, call your healthcare provider or 0800-664-2273 for guidance. A health and wellness message from your Ministry of Health.
If you have a cough or a sneeze, cover up to the right thing, please. Boys and girls, the entire family, to protect the weak country. Wash your hands properly. Wash your hands regularly. Soap and water is all you need to scrub and rub naturally. Coronavirus, seriously, it took over the world practically. Stealing lives with no remedy. Yeah, pay everybody the casualty. Boys and girls, the entire family, help protect the weak country. Wash your hands properly. Wash your hands regularly. Soap and water is all you need to scrub and rub naturally.
In response to COVID-19, the government of Belize has implemented strict guidelines on persons to practice social distancing to reduce the spread and risk of getting COVID-19. Practicing social distancing is when one maintains a greater than usual distance away from another person. In public health, it is a practice to prevent sick persons from coming in close contact with healthy people. Recent studies are showing that social distance of 3 feet or more decreases the exposure of COVID-19. Before these restrictions, a person with COVID-19 could infect 2.5 persons in 5 days, 406 persons in 30 days. When you put into practice measures to reduce the exposure activities by half of that one infected person, in 5 days you would possibly only infect 1.25, 30 days, 15 persons. Reduce the exposure of that infected person by 75%, in 5 days you infect 0.625, in 30 days 2.5 persons. Remember, the virus does not move on its own, people move it. The more space between you and others, the harder it is for the virus to spread. A health and wellness message from your Ministry of Health. If you have been directly exposed to the new coronavirus or have a history of travel in infected populated areas, it is recommended that you self-quarantine. Identify a room to be used to self-quarantine and limit contact with healthy persons. Keep away from older persons and persons who have medical conditions that affects their immune system. Monitor for any cold or flu-like symptom for up to 21 days and wash hands frequently with soap and water. If you become seriously ill, call your healthcare provider or 0800-664-2273 for guidance. A health and wellness message from your Ministry of Health.
If you have a cough or a sneeze, cover up, do the right thing, please. Boys and girls, the entire family, to protect the weak country. Wash your hands properly. Wash your hands regularly. Soap and water is all you need to scrub and rub naturally. Coronavirus, seriously, it took over the world practically. Stealing lives with no remedy. Yeah, everybody see our precious.
Good afternoon. We're gonna do another question and answer segment today. Sharon Espinosa is joining us today. We're gonna be having a discussion, first of all on testing, but one of the other topics in terms of health is vaccination. It is vaccination week in the Americas, and Sharon is gonna give us a breakdown of how that works for our context, but also because we cannot forget the other health issues that are still going, that need to be ongoing, because not everything in health is COVID-19 related, even though it seems like that since the beginning of the year. Can't forget the fact also that on Saturday there was a World Malaria Day, and Belize could very well be at the end of this year a country that has will start the process of certification to see if we have eliminated malaria effectively in Belize. So that's part of the ongoing success stories, vaccination being another one that we for sure have in the health system. So in terms of the breakdown that we are going to give you with testing, I was not really planning to have any Q&A this week because I think we have only been seeing me around whenever there's bad news, so to speak. But the major shifting of headaches, as I mentioned to the Oversight Committee earlier today, is I feel, and the sense that we are getting from the health standpoint is that this week people have been kind of being a little bit more relaxed or laxed in the attitude, or at least the perception we have. We are seeing a vast amount of people on the street. We are supposed to only be having essential services functional this week, but we are not so sure that that is in point of fact what is happening. We are seeing people around the parks, people on the street, along the highway, lots of cars on the highway now, and so that is getting us very nervous, and we feel that that is a major cause of concern and certainly another headache as we move along that we'll have to grapple with. But in terms of testing, I wanted to say, you have seen the infographic from yesterday where we have 9 recovered cases, 7 patients that are still considered to be active. But I want to touch also, because in discussions with the team earlier today, that recovered notion is something that we need to be very careful about, because we say somebody has recovered when you have 2 negative COVID-19 tests. But we want to make sure that people are in point of fact not going to be having any further viral shedding. So eventually we will have to come back to these persons and reswab them again. Just reading a story earlier of somebody who has tested positive after having was initially negative, positive, then negative, then positive, then negative and positive again. Not in Belize, but that's part of the ongoing dynamics that we have in terms of COVID-19. So all those patients that have been deemed to have recovered, we need to understand that they still need to take the necessary precautions. They still need to be able to use a mask, use all the necessary precautions, assuming that they can still be infecting others. Understand also that there is some literature that clearly indicates that doesn't seem that everybody develops immunity. If that is the case, then that means that the patient is going to get reinfected again, or can potentially get reinfected again, because you have not developed immunity to be able to stem off another wave of an infection. So that's something that we need to review. So anybody who has been positive, it would seem, if you don't develop immunity, that you can get reinfected again in a second wave, if you will. So that's where we are going in terms of our testing. You will note also that it's been 16-17 days since we last announced the last 4 cases. We are in the process of reswabbing all of these last 4 cases to see whether they have recovered or not. Our perception is that by Friday of this week, we should be having 3-4 more persons out of those 7 recovered. So that's important for our purposes, but now we have started the process of expanding the testing situation. In discussions with Central Health Region, which deals with the Belize District, I can tell you that there have been random testing that has happened at banking facilities. So elements of that have happened. Some policemen, some BDF have also been randomly screened. It's important that we say that. But we also develop a listing of potential frontline workers that we can go and do random swabbing, if you will, or random testing. Understand that we are not going to be testing everybody, but in our listing we have, for example, people from elderly homes, the caregivers of those people in elderly homes, Coast Guard, Immigration, Customs are in our list, healthcare workers, even if they are not ill, which will include nurses, doctors, pharmacists, lab technicians, bus operators, water taxi operators, tour guides. So what we are doing is developing a listing to look at numbers of persons in these different categories, and then we'll do a random sampling, which means if I have 422 doctors in the official list, 10% of those would be 42 doctors that you would do random sampling. It's not going to be on a volunteer basis. We are going to do a randomization process, which is a statistical method that will be done to identify where and who these persons are going to be. That's what we're trying to do as we expand our testing. And we're going to start that as early as we move into this weekend. Also, as we are getting less people that are tied to the last cases, understand that we are not going to be necessarily testing every day. Why? Because we're going to be swabbing people across the country. And if you don't have anybody that's critically ill, remember we are looking for people who are asymptomatic, trying to tease out asymptomatic carriers. Then you won't necessarily have to rush all these samples to Belize City and run them through. So we may be moving towards doing testing every 2 days. The lab has confirmed that they would be in a capacity to run 90 tests daily, at least for the next couple of weeks, to determine what our potential number is out there. But as we move along, we may not be doing testing every day. Of course, if you have any critical case that you need to make a determination, those will go through rather quickly. But just so that you know, in terms of how the infographic eventually is uploaded on a daily basis. You will notice also that we have started sharing data, how we compare to other countries. People have bigger epidemics than our neighbors, so that information will continue to be placed on a routine basis on our website. We are looking at other testing possibilities, yes, eventually looking at the possibility of testing for antibodies, but we don't have an approved test as yet. That will not replace the current testing procedure that we are doing, which is PCR testing, because you would be doing what's called a parallel testing. You test PCR, which is what we are doing, which is the gold standard, which is the ideal test to determine any case. And antibody testing would be to see whether you have developed immunity to the virus or not. That we hope to introduce towards the end of May once you have approved antibody tests. Same thing becomes applicable to rapid tests. Once they have been approved and are available in the market, we should be having access to those. Again, we are thinking perhaps towards the latter part of May. One other thing I have that I need to update people on is the treatment options available. You know that there was a lot of hype around hydroxychloroquine, chloroquine, lopinavir, ritonavir, interferon, but recent studies would suggest that hydroxychloroquine doesn't seem to be as effective as it was initially thought to be. As a matter of fact, one of the warnings now is that you may actually have more detrimental effect with the use of chloroquine and hydroxychloroquine, so that we are asking that those elements of the guidelines be reevaluated and see if we need to take it out. Same thing with lopinavir, ritonavir, which we never used in Belize, not for COVID-19, but again, the newer suggestion is that it doesn't seem to work. We are following what other countries are doing. If remdesivir is another medication that seems to show some benefit, we don't have that available in Belize. And there's a Mexican cohort using steroids and a medication used for rheumatoid arthritis that we are also following closely. We have a small study sample that is showing some potential benefit. But again, this is all a work in progress for us. Our swabs, because we had a little bit of a delay, they didn't arrive on the flight on Saturday. They should have arrived or are arriving on the flight today. The ventilators that were pending to come in also arrived via ship. They didn't come through the usual route of the plane, so that's something that I think is positive from our end. So that's why what we had to do in terms of share in terms of the testing. I will go to the first questions and then I'll ask Sharon to talk about vaccination week and also how we will go about revamping and bringing back the vaccination schedule and trying to catch up with all those cases that we had not been vaccinating for the last 3 or 4 weeks. So let me get to the questions that are here, and then since Bowen donated 10,000 reagents, can we go about testing 10,000 people to at least have one person tested, perhaps 1,500 in each district? Yes, I said there's a random methodology. We have been getting lots of calls. Can I volunteer? Can I pay to get tested? While that might be an option, remember we are going to be looking for asymptomatic carriers, people who are potentially more exposed. So you are going to have, you can't be doing procedures that are going to give you a low yield. If you have somebody that never interacts with anybody else, then there's no sense in swabbing that person. You swab those who are potentially more exposed, and the random sampling of all these frontline workers would give us an opportunity to test people from across the country. Just to give you an idea of how difficult it may be in terms of randomizing or picking people from randomly from a group, then we asked BTB for information in terms of hotels, and they gave us a listing of 150 hotels that had 100 or more guests for the month of March. But they were not able to tell us how many people are employed by each of these 150 hotels, or how many of the hotel people were actually exposed to any potential tourists. So that gives you a picture of how difficult it may be to eventually get a total sense of numbers. So you're going to have to go through a methodology process to pick those persons. Beyond the reagents, the reagents that Bowen and Bowen is donating have not arrived. They are arriving in May. And again, this is not necessarily things that are easy or difficult to get. You have to deal with the logistics of how it gets here, but you also have to deal with the fact that these are items that are on a wait list from the production company that all countries are buying from. So it's not only a question of the finances. As is, we would have the ability to, with the reactions from PAHO, that they are donating a total of 14,000. So that would give you an idea that you could potentially test up to 14,000 people. Understand also that this is right now, this is for the next 2 weeks. If you don't identify a case, then as we had said, for this outbreak, this first wave would have considered to have been over. But don't confuse that message with the fact that we are saying we are over COVID-19. We can have potentially many more waves throughout the year. We don't even know if this is going to be a cyclical annual activity that happens, but when we have said this, we are talking about this specific outbreak, and that's why we wanted to have a Q&A to discuss that specific item. We cannot let our guard down. If we are thinking that there's a potential case out there that's asymptomatic, then we cannot let our guard down, because then you're going to have a second wave that can be much more intense and can spread much more quickly than what we have had so far. Since recovered patients are presumably testing positive again after some days, is it recommendable that they adhere to stricter social distancing? Yes, that's what we said, yes, because they could be doing viral shedding even if it's not recognized. So what we have decided as a team is to develop a little sheet of an information sheet for all these persons that are recovered, so that we are explaining to them what it means for them to be recovered, what measures they need to take, and that down the road we're going to come back and request that they need to be reswabbed as a public health measure. Why not make the mask mandatory when out in public? Well, I think that's part of the regulations that is being considered. We make recommendations, but it's beyond the mask. Let's not forget the other elements, which I think we are sensing that people are starting to forget. I think people are assuming that our cases are going down. I put on a mask and I can go about my business. So I can put my mask and go to the river or be traveling on the bus leisurely. Remember, before you even get to the mask, if you have no business on the street, then no business on the street, stay home. Wash your hands, don't be touching your face. If you are ill, then you cannot be out on the street. You should be calling us so that we can come and swab you as part of our influenza-like illness investigation. So the mask becomes your perhaps fourth or fifth layer if you have to be out on the street. But that's a consideration as we move along. Of the 995 tests, are these repeated tests? Yes. People who have tested positive will have to be retested again until you determine that they are negative. So you will have some people that may have been swabbed perhaps up to 5 times. We have had people who tested negative, by the way, and on their second swab to determine whether they recovered, they tested positive again. So understand that the recovery process is not a straightforward mechanism and every patient is different. What is the actual total number of persons tested to date? We should be able to provide you that, but it's closer to 750 persons that may have been tested. And those, it could be more, but that's the preliminary data I have this morning. What is the short and medium-term plans in terms of reopening the economy in a safe and limited way? That's a difficult question to answer, because if you identify any case this time around, you eventually have to start to consider going a lockdown measure, and lockdown might not be the adequate term. Is how you go about living in a new social norm, then in new terms as you come about it. I think the consideration that we should all be having is not how and when we are going to open short-term, medium-term, and long-term, but it's what we are going to do to be able to go about our business in a safe way. I think that's the consideration that we have, because even as everything is being opened up, we are recommending that everybody, the physical distancing, not social distancing, physical distance that you need to be able to put with others needs to be there. We need to continue to emphasize the fact that anybody you meet on the street, you have to assume is a COVID-19 case. If we are able to understand that and we go about our business, then I think we would have taken a step forward. My headache right now, to be honest, is that my immediate personal perception is I don't think we have learned much from what has happened in phase 1. That's my personal perception. I think we're starting to go about doing our business as if nothing has really happened, and that can't happen. Can you comment on the testing developed in Senegal? I am not aware of that, so I can't make a comment on that. Do you recommend casual visits in the country to reopen? I don't know what a casual visit is. I am not visiting anybody casually, and I don't think anybody should be having casual visits right now. And even casual visits will have to be revisited whenever we start to go back to being normal. The country to reopen, if you're referring to borders, I don't know whether that is going to happen or should happen, because again, we give public health measures. The way it is going right now, the US is nowhere near, I think, starting to go down with their curve. Mexico saying our curve is not going to peak until the end of May. So I don't know that we should open anything with our neighbors right now. Is it appropriate for villages who are spraying the vehicles? They are also using a dish with soap and chemical for the people to place their feet in. Is this appropriate to do? I don't think so. I don't know what cocktails they are doing or mixtures. So that it needs to be an adequate public health standard for that. But I don't know that has been proven to be effective. Wouldn't it be beneficial to decentralize testing? Yes, once you have a platform that's available. For now, PCR testing is the only standard available, and that's why it's only available at Central Medical Lab in Belize City. Can you address the COVID-19 situation in Chetumal and Quintana Roo? The overall Quintana Roo state is following the same pattern as the rest of Mexico is, which is increasing numbers, and they are not expected to peak until the end of May. That's important that we understand that, so that people should not be in a hurry to get across the border. That is another headache that I think we need to highlight. We are noticing that people are still either trying to smuggle themselves into Chetumal or smuggle themselves back into Belize. That's a very touchy situation. We have a high-risk case right now in Corozal, who apparently was in Chetumal, of course illegally because the border is closed. That's a situation that we really need to take a grasp of. That should not be happening. Chetumal doesn't have that many cases. Our numbers similar to the ones we have in Belize, but the overall state of Quintana Roo, particularly Cancun, Playa del Carmen areas, have a significant and growing number of cases. Amount of persons that you would be recommend to be allowed to travel in a bus, we had a discussion with the oversight committee, so I think that recommendation should be coming out by tomorrow. Of the 995 tests, how many were failed or inconclusive? I don't know that we had a failed or inconclusive test. If we don't identify anything, they might be run a second or third time from the same sample. So I know samples have been tested up to 3 times a same sample. Of course, they are only counted once in that regard. With people with pre-existing conditions be included in the randomized testing, yes. We have included people in ICUs. One of our cohorts group is people older than 65 who are in the hospital, or people who show up for any other condition inside a hospital setting would be randomized into the group, yes. And I think I have one more question. Any positive test for 2 weeks and counting, no cases of acute respiratory failure. Can we conclude that Belize does not currently have COVID-19, assuming that the borders remain closed? We would want to wait until May 11th because you would have done 2 cycles of the incubation period before we can say that we don't have any case. It doesn't seem to be right now, and the number of acute respiratory failure cases has decreased significantly. So we have to be on the lookout. And again, if you're having people that are going to the northern border illegally, in the back of our minds, that's where I think the next wave can potentially come from, is with people who are going across the border. Assume you're able to lock down as a country, then you have nobody else coming outside, and you are able to determine that there's no more case. Eventually, what is going to break can be a case of somebody who goes across the border and comes back, or is doing that mechanism on a routine basis. Recall El Salvador, completely locked down, in isolation. How did they get it? Somebody who got smuggled into the country from Italy. Same potential situation. To be honest, that is where I think our next potential case can be. If everything remains as is and no border is open, I think that is where the case can potentially come from. So those are my notes for now. I think, Sharon, we can start talking about vaccinations now.
Thank you, Dr. Manzanero. We are celebrating now the 18th vaccination week in the Americas, and the theme for this week is Love, Trust, Protect, #GetVax. This year's theme brings to mind the love that people have for their children, themselves and their communities, the trust in vaccines' ability to save lives, and the protection they provide from diseases for everyone from everywhere. The history of Vaccination Week in the Americas, it actually started in 2002. There was an outbreak of measles in Venezuela and Colombia. And health ministers, they got together from within the region and decided that yes, we should continue this Vaccination Week in the Americas, strengthen our regular immunization programs in the Americas, and it also identify and reach populations who are most at risk for contracting vaccine preventable diseases. I would like to share some of the achievements that we have in Belize, that we've achieved in Belize as it relates to the immunization program. We have sustained coverage for over 95% for over a period of 10 years. And I'm speaking specifically to our primary series, our BCG or pentavalent vaccines, our polio vaccines. We have maintained 95% or greater. We are currently vaccinating against 13 diseases. We are in discussion for introducing 2 other new vaccines, the rotavirus vaccine and the pneumococcal vaccine. Last year, I believe it was, we had some cases of diarrhea and vomiting, and some of them were in fact rotavirus, due to rotavirus. We must say also that since 1981, we have not had a case of polio in Belize. In 1991, we had our last case of measles, neonatal tetanus, 1997, congenital rubella syndrome, 1997 as well, rubella, 2001. So we see where the entire program has been working for us, and we want this to continue. Now, due to the fact that we have COVID-19 in our midst, activities for Vaccination Week in the Americas had to be adjusted. So all the campaigns that we had scheduled, the school vaccinations, the health fairs, the parades, all of those we had to cancel because we want to ensure that we comply with physical distancing, and also we want to protect our vaccinators, our nurses, and other health workers in the field. So we had to make the adjustment, and I must say that across the country, we are administering vaccines. The vaccination program, the vaccination services continue. What the nurses are doing, they are actually making calls to parents to bring in their babies. We want to comply with physical distancing, as I said before, so we are calling parents to come. We also do mobile visits, home visits, identify also specific area where we can meet parents for vaccination. We are particularly at this time with COVID targeting those babies who need specific vaccines that are mostly outbreak related. For example, our measles, mumps, rubella vaccine. So we want to bring in our children that are between the ages of 12 months and 18 months to get their MMR vaccine. Also, at 6 months, that infant should have received a 3rd OPV vaccine and pentavalent vaccine. So we are looking for all those babies who are 9 months, are behind with schedule. We will have them come in. And the newborns, we are ensuring that before hospital discharge, they would have received BCG vaccine as well as the hepatitis B birth dose. Just a little reminder about some of the common side effects after vaccination. Fever is quite common, also pain at the site and maybe some redness. This is normal. Tylenol we usually give that will relieve the symptoms within a day or two. As soon as this COVID wave has passed us, we will resume with regular vaccination. A note to mention here is that I'm sure some of you may have seen that persons are saying that BCG and OPV vaccines can be used in preventing COVID-19, but WHO has informed us that that is not so. So far, there is no evidence that BCG vaccine protects against SARS-CoV-2. There are 2 clinical trials that are on the way addressing this topic, so we have to wait until we get the results of those. Likewise for OPV, there is a clinical trial that is planned to be conducted in the United States. So as soon as we get those, we will share. In addition to vaccination services, we continue with the surveillance and investigation of vaccine-preventable diseases. We do surveillance for all vaccine-preventable diseases. We have 6 sentinel sites across the country. These include clinics and hospitals. Cases are reported to the ministry. The regions investigate. Even when we have rumors, we also do investigation of suspected case. Specifically for measles, we are on heightened surveillance. Our fever rash cases, we are investigating. Even though Mexico currently have a problem with COVID, a huge outbreak with COVID, we also must recognize that Mexico also have an outbreak going on with measles. And as Dr. Manzanero mentioned, we are still hearing about persons trying to get across the border. So we can't let our guards down as it relates to our vaccine-preventable diseases. In terms of a vaccine for COVID-19, we still have to wait, so anywhere from 12 to 18 months. However, I was informed also that they have decided that they will increase and rapidly try and put this vaccine together so that we can get it in a much shorter time. Vaccine supply and management, we continue with that. We are receiving our vaccines on schedule. We have a vaccine technician who manages our supplies of vaccines, so we have enough vaccines to take us through for the rest of the year and also into next year. Prepayment for vaccine is on target. We pay for vaccines through the Government of Belize revolving fund. We maintain cold chain for vaccines to ensure that the potency is there from manufacturers to the point of administration of that vaccine. I will, at this point, take questions. Let me see.
Do you see the questions?
I am.
If not, I can read them from here.
Yes, please.
It says, how can preschool-age children get their booster shots under the current circumstances?
Okay, as I said before, we are looking at those vaccines that have real big outbreak potentials. So the preschool booster shot, yes, it is important, but because we are trying to stay within the context of limiting people moving around, we will withhold. However, you can call the clinic, you can call your nurse, and they can arrange for vaccination for the boosters. Yeah, I'm seeing the questions now. Okay. It says, can you speak about BCG as an overall immune system viral defense booster and any long-term benefits? We see countries where it is not universal. US and Italy have high death tolls. As I said before, we have no confirmed evidence that BCG do protect against COVID-19. Are 5-year-old children entitled to any of the vaccines you mentioned? Yes, the booster vaccine, usually at age 4, we give the second booster vaccine, DPT and OPV. So as I mentioned, nurses will be calling and they will set up appointments. If I had 2 doses of Hep B shots, but I missed my 3rd dose recently, Will I have to redo all 3? No, you do not. You just continue and you get your next dose. Okay. Okay.
Yeah, I'm not seeing any more questions.
It says, can you speak about the other significant public health hazard right now, which is smoke?
I'm not seeing those questions coming up, but I know that there are some questions about in terms of reopening, and one is the decisions that we take as a country are taken by the country. We are guided by WHO and CDC guidelines, but it's not any particular public health agency that is going to tell us when to reopen. I think that's very important that we stress that, because it doesn't work like that. We basically do, guided by what public health does, and we have a singular opportunity to be looking at situations where we are learning from other Caribbean countries, and that's why we come to the table and give you our recommendations based on the evidence as it's evolving. We can take particularly, and it was just our information officer is just telling us that St. Lucia earlier had said that they had recovered all their cases. St. Vincent and the Grenadines had said the same thing, and now they are coming back to say we have cases now, contacts, late contacts, if you will, of those previously diagnosed and recovered cases. So those decisions will be taken solely by the country. We make the recommendations, and the country makes the decision in that regard. So it's asking if we can talk about public health hazard right now, which is smoke and particle inhalation in the West. We are aware of the situation. We are aware that people are coming in with respiratory symptoms. It's a little bit of a difference because it's an irritative cough that people are having, and people are not having the other symptoms that would be present in COVID-19, which would be chills, body aches, fever, which are more characteristic of an ongoing infection. It is indeed a public health concern. We had put out a statement after the Department of the Environment had done one, and I know there are some mitigation measures in terms of that, coupled with the drought situation that we're undertaking. So there's many health hazards, and again, it underscores the relevance of climate change and health. That climate change does have an impact in health. I saw some question in reference to dengue as well. Is there a dengue outbreak? Well, there are cases still around. Dengue doesn't really go away. Even last year, we had a drought situation, but we had alerted of a possible increase in the number of cases, and we had 10 deaths associated to dengue last year. The same situation can happen here. Again, the situation, for example, with the patient in Corozal, which seems to be dengue, but because there can be symptoms that are rather similar, we are still going ahead to swab this person and then looking at whether they have COVID-19 or not. Interestingly, we did talk about the BCG vaccine. What we have noted also is that people who had this little chronic cough are starting to show up in our health system. So it would seem that now, with the flu symptoms being more prevalent and we are discussing it more, we are seemingly detecting more cases of tuberculosis. And that's an interesting matter because it's another public health measure that we had not routinely been, or people had not been routinely coming to the system, but now they are being detected that they have tuberculosis and not necessarily COVID-19. I think there's more questions.
So I have a question here.
Two,
if
I
an
think.
elderly asthmatic person had been recommended the pneumococcal shot, how can that person get it? Remember I said that that vaccine will be coming on stream for us. I am not sure if the private sector offer it, but currently in the public health sector we do not offer the pneumococcal vaccine. Vaccines for newborns, the first shot, when will that be available, or is it available in Belmopan now? Newborns get BCG and hepatitis B, and we are ensuring that before hospital delivery, the babies can get these two vaccines. And this is across the country, in Belmopan and in other parts of the country. Any other?
Yeah, I know also this, I saw a trending situation on social media earlier today in terms of us asking people to stay home and understanding that people have different economic and social situations or determinants that, I mean, for some it might be easier than others, and we are fully aware of that. We have always been fully aware, I think, of the social conditions and social determinants of health. Is a key indicator. So we are not telling people to stay home eternally, but I think this time that we have asked people to stay home should have allowed us, and I think that's a message that we may perhaps find a different way of saying it, is once you do go out, because you have to go out, I mean, we have also said that for the next 2 years our lives are not going to be the same. Even when we do go out, we have to ensure that all these measures that we have talked about, assume that everybody going to meet on the street is going to be a COVID-19 potential case. That is perhaps the mindset that we need to ensure that everybody gets. So beyond the staying home, is whenever you go out into the public, you have to assume that everybody is a COVID-19 case. So the measures that you take in terms of hand washing, not touching your face, wearing a mask or not, those are here to stay. That's not going to have anything to do whether you find a case or not over the next 14 days. That's the new norm. That's the new situations under which we're going to go back to doing our routine activities. So we really need to make sure that that is the message that we are getting across to everybody. I don't know if there's any other question. Oh, the other question that people keep asking is, why have we not said where the recovered cases are from? And I go back to the same premise that we have always had. At the end of the day, it should not impact me to know whether all the cases in the Cayo district, and I'm saying this because we're here in Belmopan right now, whether all of them have recovered or not. We should not really, that should not be the concern. If we're going to be out on the street, we have to assume that everybody is a COVID-19 case. So, I mean, if I have no business on the street, or even if I do have business on the street, the basic premise is whoever you meet has to be considered as a potential COVID-19 case, and you have to treat it like that.
So I have a question about phone numbers for the clinics. I have for Corozal, it's 4220541. I have a number also for those persons in San Narciso, 613-1164. Orange Walk Town, you can call your nurse at 670-9423. For San Felipe, 670-9407. August Pine Ridge, 670-9438. Guinea Grass, 670-9439, San Jose, San Pablo, 670-9416. And you would be speaking to your nurses directly, and you can ask your questions, set up the appointments for vaccination, or any other maternal and child health services that you may need. For Belize, the COVID hotline number, 613-0787. For San Pedro, you can call 613-0690. Keycorker, 226-0166. For Ladyville Health Center, 613-1027. Belmopan, we have a number 828-4512, and San Ignacio 662-9692. In Stan Creek, the maternal and child health services were relocated, not very far, but there is a cell number that you can call and get information as it relates to your maternal and child health services, 614-4129. PG 670-9590, and San Antonio 670-6368. Any?
Yeah, I think
I just want to say thanks to the general public for making this vaccination program that we have in the ministry such a success. Your cooperation in terms of attending your scheduled visits, we appreciate. The Ministry of Education as well, they partner with us for vaccination in schools. So to the many teachers and principal and other persons from the Ministry of Education, I want to thank you also for your support. Of course, thanks to our donor agencies, support from PAHO, support from UNICEF, EU, IDB, and of course, finally, but by no means the least, thanks to the many public health and rural health nurses across this country that work so hard to make this program the success that it is. As a country, we know we are aware of what you're doing. We see the effects. We have not had a case of measles since 1991. We have not had a case of polio since 1981. This is all the work of the vaccination program and the hard work of the people within the Ministry of Health. So we thank you for that.
yes, Sharon, two things I would want to capitalize as we wrap up. One is highlighting the fact that it is a successful community engagement that allows us to have a successful immunization program.
Yes.
I think it's the same thing that happens in terms of COVID-19, even though we have taken only baby steps. If we are where we are now, it has had to do with the measures I think we have taken, but it's also the society and the community being able to engage and latch on to the message we have given. But if we are going to have any successful further containment, I mean, if this first wave we are able to successfully contain it, beyond the work that we are able to do as a Ministry of Health, it has to also be given credit to what we are able to do as a community. So that's why we are here seeking your ongoing engagement as we go about doing a new norm. And you also highlighted the valuable work that I call them foot soldiers, the public health people, the public health nurses and the rural health nurses. And when we talk about frontline workers in COVID-19, I want us to be drawn away, not only to concentrate on the doctors and nurses that you see within a hospital setting, which is where I think most of the credit is going, and we all have a role to play, but we cannot forget all the public health nurses, all the rural health nurses, all the public health inspectors that have been engaged to ensure that patients don't reach a hospital setting. So I think our successful strategy in COVID-19 has had to do with successful public health ground rules. I mean, it's whatever we have been doing as a public health entity that I think has taken us to where we are. If there's any further containment, it has to do with the community and a successful public health intervention. And I can tell you I'm a converted person because I came from private sector as a pure clinician into the Ministry of Health, got involved in epidemiological work in public health / global health policy, and converted in the sense that you have to underscore the value that public health does in successful containment of all the vaccine preventable diseases you have had. But if you're going to construct a story in terms of COVID-19, it has to be heralded on that work from public health, which trickles also to the malaria situation. So please, folks, do continue to listen to the verifiable sources of information. We're going to use the same avenues for communication. And again, it's not that we are asking that you necessarily stay home, but if you don't really have anything to do on the street as we go about establishing new norms, this is the time to digest how you're going to go about when you start going about doing your routine activities as we move along. Because this is for the next 2 years, and if we are able to understand that for the next 2 years or more, but at least for the next 2 years, this is how our new lives are going to be, then I think we will have taken would have learned something and taken a positive step in this regard. So thank you very much for listening, and we'll see you soon.
Thank you.